Today, we'll explore a fascinating topic, the prostate and its essential nutrient for maintaining prostate health. This subject was inspired by a valuable book I recently discovered, Soil, Grass, and Cancer. Now, this book was a bit on the expensive side, priced at $250, and I couldn't find any used copies. However, it's packed with insightful nutritional information. Each chapter covers a different aspect of health, and the last chapter delves into the connection between zinc and the prostate. Let's delve into some of the key findings. First, it's essential to clarify what the prostate gland is. Many people are uncertain about its role. Aside from the fact that it tends to enlarge with age, affecting urination. As men age, about 50% of those over 60 experience prostate gland enlargement. This growth can impact various aspects of health, such as urination flow, libido, urine retention, and even lead to a backup of urine in the kidney. To understand why this happens, we need to explore the prostate. It's somewhat peculiar that as men get older, many of them encounter prostate issues. It's important to note that not all prostate enlargement is due to cancer. Let's begin by pinpointing the prostate's location. It's situated just behind a small bone in the front part of the pelvis called the symphysis pubis. The prostate is also positioned right beneath the bladder, and it surrounds a little tube that extends down from the bladder. In terms of size, the prostate is approximately equivalent to the size of a walnut. The prostate might not be large, roughly the size of a walnut, but it can grow bigger over time. It's located behind the symphysis pubis bone in the front part of the pelvis, just below the bladder, and it wraps around a tube that carries urine from the bladder out of the body. Additionally, the rectum is right behind it. Now, let's delve into what the prostate does. It's mainly composed of about 70% glandular tissue and 30% muscle tissue. Its primary functions are twofold. First, it helps secrete a specific fluid that we'll discuss shortly. Second, during ejaculation, it acts like a pump to push this fluid through the same tube where urine travels and out of the body. Sperm, which carries the male genetic information, is produced in the testicles. It takes approximately 60 to 70 days for sperm to develop fully. These sperm then travel through a small tube into an area of the prostate where additional glands produce a fluid. All these fluids, including the prostate's contribution, combine to form what we call semen. The role of semen is crucial. It nourishes and supports the sperm. The sperm itself carries the genetic material from the male, which will eventually unite with the genetic material from an egg to create a new human being. For this process to occur successfully, the sperm needs nourishment, and that comes from the fructose in the semen. Certainly, let's dive into the crucial role of enzymes in helping sperm penetrate the uterus lining. This is essential because the mucus and various factors within the female reproductive tract impose challenges to sperm's journey. Sperm, when outside the body, can remain viable for about 5 days. On the female side, there's an egg that's initially inactive, but becomes active once it's penetrated by a sperm. This is an overview of the prostate's involvement in the context of these processes. Now, what's intriguing about the prostate concerning nutrition is that it contains the highest concentration of zinc in the body. In fact, the prostate has about 100 times more zinc than your blood. This means that a normal zinc level in your blood might not accurately reflect what's happening within the prostate gland. The book I mentioned sheds light on some critical points. The book discusses the link between a zinc deficiency and its impact on the prostate gland. A study conducted highlights this connection. A healthy, normal prostate contains approximately 744 micrograms of zinc. When the prostate enlarges slightly, a condition known as mild hypertrophy. The zinc content decreases to around 486 micrograms. In cases of chronic prostatitis, the zinc level further drops to about 470 micrograms. Keep in mind that these measurements are in comparison to a healthy prostate, which typically contains 744 micrograms of zinc. Now, let's delve into the intriguing connection between zinc and the prostate, particularly in relation to prostate cancer. Research indicates that the average zinc level in cases of prostate cancer is around 273 micrograms. This underscores the link between a lack of zinc and the inflammation and enlargement of the prostate, which can increase the risk of prostate cancer. And there is another crucial aspect to consider: a potent form of testosterone called DHT dihydrotestosterone. Testosterone can transform into DHT with the help of an enzyme known as 5-alpha reductase. Certain medications are designed to inhibit this enzyme, which can be beneficial for conditions like pattern baldness, prostate enlargement, and erectile dysfunction. Interestingly, zinc naturally inhibits this enzyme. What's noteworthy is that individuals with low testosterone levels are often found to be deficient in zinc. Therefore, zinc stands out as the most vital trace mineral to maintain high testosterone levels, support sperm fertility, and ensure the prostate stays at a healthy size. Now let's explore the intriguing question: why might someone lack sufficient zinc in their diet? There are several reasons for this deficiency, and I'll walk you through them. One common factor is a limited consumption of red meat. It's essential to consider that there is a prevailing trend, especially among men as they reach the age of 50 and beyond, to reduce or eliminate red meat from their diets. Red meat has been somewhat demonized, often without distinguishing between various types. Notably, there's a failure to differentiate between processed meats and healthier options like grass-fed organic meat. It's important to remember that all red meats are not the same. Additionally, dietary advice often emphasizes lowering cholesterol intake, which is a vital component for testosterone production. Instead, individuals are often encouraged to adopt plant-based diets and increase their consumption of whole grains. However, whole grains contain a substance called phytic acid, which can interfere with zinc absorption. This is significant because zinc deficiency affects a large portion of the global population, with an estimated 2 billion people lacking sufficient zinc. This is partly due to excessive cereal and grain consumption. Another intriguing aspect of aging is the decline in stomach acid concentration. Stomach acid is crucial for the absorption of zinc. If you have low stomach acid levels, you'll struggle to absorb zinc properly. Furthermore, taking antacids can lead to zinc deficiency. Similarly, diuretics, statin medications, and excessive alcohol consumption are known to deplete zinc in the body. High sugar intake and a habit of frequent late-night snacking can lead to insulin resistance, which can also reduce zinc levels. This brings me to a significant point. If you're not getting enough zinc in your diet, it can negatively impact your libido, testosterone levels, and sperm count. Moreover, it can affect the size of your prostate and ultimately your urinary flow. It's a great source of zinc is shellfish, particularly oysters. The second best source is red meat. It's worth mentioning that there are zinc supplements available, including my Trace Minerals product. However, it's essential to note that taking zinc alone won't guarantee a cure for conditions like an enlarged prostate, low testosterone, or reducing your risk of prostate cancer. These health factors are influenced by various elements, including your diet, alcohol consumption, stress levels, and the medications you're taking, among other considerations.